What's really novel in this study is that for the first time ever in MS, somebody looked how the development of cortical gray matter atrophy, which is a very important component of the disease in later stages, but until very recently has been almost unknown in the early stages of the disease, contributes to development of clinically definite MS. So there are, I think, two very important components of this study. The first one is really biological, and that is when you look people as a group, whether they have been treated or non-treated, and then you look conversion to the clinically definite MS. There was a very high association between people who developed cortical gray matter atrophy and converted during the 2 years of the trial or in the year 3 and 4 to clinically definite MS. So the point I'm making is, I think, of extreme importance that cortical disease in these patients from the first onset is present already at the first clinical attack and accelerates very much over the 2, 3, or 4 years of the disease to predict clinical outcomes, which is conversion to CDMS. Now, the second component of the study was obviously to look the effect of Aubagio on whether it can or cannot slow down cortical gray matter development, and I think we found very, very strong data that both doses of Aubagio, 7 and 40 milligrams, slow down cortical gray matter atrophy respect to placebo, starting already for month 6 and continuing at months 12, 18 and 24. And also we found that when we divided these 3 groups in those who were treated or not treated, there was much proportion of patients who developed less cortical atrophy with Aubagio compared to placebo. And on the other hand, there were many more placebo patients who developed more cortical atrophy, especially higher than 1.8% per year of cortical atrophy loss than Aubagio patients, and that highly correlated with development of clinically definite MS.